You're here to talk about Pucker Up, a social enterprise you've created, and really the importance of mental health and well-being. Can you just tell us a bit about Pucker Up?
Yeah, so Pucker Up's an organisation which I founded 3 years ago, and we've, for the last 3 years, worked incredibly hard around advocacy, normalising mental health and emotional well-being, with every initiative that we've delivered over that time. But we also recognise that talking about it alone is not a long-term solution. Getting people into the conversation and discussing is important, but we need to do more than that to have a viable solution strategy. We're actually 3 weeks away from rolling out our workplace wellbeing workshops and programs, and they're an evidence-based programs. And why that's really important is the programs and the workshops educate people in workplaces around the country so they can develop the skill set and capacity that allows them to manage and proactively maintain their well-being, compared to the way that a lot of Australians, myself included for a long time, we react to a situation. And that means that there's been a build-up of stress in a person's life. We either get really stressed, overwhelmed, or we potentially become quite sick with mental health conditions. So our sole focus is to continue around the advocacy, creating environments that allow people to come into these important discussions. But importantly now for us, it's about the conversations plus the skill set and education that allows people to make different decisions.
But mental health and well-being is something there still is a stigma attached to, which I find quite depressing actually. But really interested in your views as an organisation. What could we be doing differently?
I think it's an aspirational goal to create an environment where people feel empowered to turn up as their true self. That takes time, it takes an investment, not only financially, but in programming, workshops, initiatives that acknowledge people as the best version of themselves. And what I mean by that, if you think about it, and you're not trying to commercialise what initiative and journey you've just started, but if we were to create an environment where our people, ANZ people, felt so supported and comfortable that they could come to work as the full version of themselves, not to be critical, but there is a level of ignorance and a lack of understanding that these conditions are legitimate medical conditions. And on one hand, I find that frustrating because people that have these experiences and live with these conditions aren't doing it for attention. If we could snap our fingers, pull our socks up and just smile and get over it, we would. It's not that simple. If someone in our family is diagnosed with a potential medical condition, what most of us do is we start to invest time into what's the challenge? What is it that they're dealing with? How can I support them with regards to the experience that they're going through? So we have this capacity and tendency as human beings, if it's someone we care about, we invest the time in to understand it more. Mental health conditions are no different. You may not understand it today, but if you invest the time into reading about it, getting knowledgeable about it, what are the signs, what that does is that empowers you to be able to support the person you care about in a more productive, supportive manner. And it also, it's so powerful for the person who's going through the experience. We either choose to do nothing and stay ignorant to the issue, or we choose to invest time to support the person we care about.